For the first 23 years of my medical practice, I did everything in my power to keep my patients from taking nutritional supplements. I told them that all supplements did was create expensive urine and that they could get everything they needed by just eating a healthy diet. After all, this is what I had been taught at the University of Colorado Medical School. However, the National Health and Nutrition Surveys have shown us that less than 1% of the children and adults actually consume the RDA levels of all the micronutrients in their diet. Added to this fact was the fact that the food scientists at the USDA, who have been collecting data on nutrient contents of various foods for the past century, have documented a dramatic drop in the nutrient content of most foods within the past 50 years. Just one example is that you now need to eat 8 oranges to get the same nutrition that was provided by just 1 orange 50 years ago. Scientists have concluded that commercial cultivation of seed has traded nutrient density for yield, pest resistance, and transportability, factors critical to the commercial success of any crop. These findings alone were a great argument why everyone should now be supplementing a healthy diet. However, there is much more to this story. My wife suffers from chronic fatigue and fibromyalgia. She thought when she married a physician that her health would improve. However, nothing could have been further from the truth. Her health declined year after year in spite of being placed on several different medications. After spending several months not being able to get out of bed for more than 1 hour a day, she decided to try some high-quality nutritional supplements. Her health improved dramatically, and she was literally able to get her life back. Had I been wrong about supplements all these years? Had I been telling my patients the wrong thing? I, like most physicians, was disease-oriented and drug-oriented. I needed to understand why my wife's health had improved so dramatically when she began taking supplements. What I learned has completely revolutionized my approach to medicine, and I need to share with you what I have learned and was never taught in medical school. You see, I began studying the worldwide medical literature in regards to the health benefits my patients could potentially receive by taking nutritional supplements. I'd never been exposed to the thousands of studies that showed a health benefit when consuming nutritional supplements at their optimal and yet safe levels. What I learned was the fact that even though oxygen was necessary for life, it was also dangerous for our existence. You see, as we utilize oxygen to create energy within the furnace or battery of the cell, we also create a cellular exhaust, which is called free radicals. If these free radicals were not neutralized by an antioxidant, they could go on to damage the cell wall, vessel wall, fats, proteins, and yes, even the DNA nucleus of the cell. You see, the same process that turns a cut apple brown or rusts metal was essentially rusting us inside. Because of our polluted environment, our stressful lifestyles, and over-medicated society, we must now deal with more free radicals than any previous generation that has ever walked the face of the earth. The medical literature now shows us beyond a shadow of a doubt that the root cause of over 100 chronic degenerative diseases, those diseases like heart disease, cancer, diabetes, arthritis, Alzheimer's, dementia, Parkinson's disease, macular degeneration, MS, and the list goes on, is the result of oxidative damage. What became so apparent to me during my research was the fact that our body's natural defense systems were our best defense against developing any of these diseases and not the drugs I could prescribe. In addition, I learned that the best way to optimize our body's natural defenses was by consuming high-quality, complete and balanced nutritional supplements at their optimal levels, not RDA levels. In order to get the amount of vitamin E that was necessary to provide a health benefit, you would need to consume 30 heads of spinach, or 25 pounds of butter, or 5 pounds of wheat germ each and every day. In order to get the amount of vitamin C necessary to provide a health benefit, you would need to consume 80 avocados or 18 large oranges each day. There was no way a healthy diet could provide this level of nutrition. The only way my patients could achieve this level of nutrition was to take nutritional supplements as part of a healthy lifestyle. In fact, if you were able to put all the medical and scientific advances from the beginning of a time into a 24-hour clock, this knowledge that I've just shared with you has occurred in just the last 7 seconds. Because we now can study the intricate functions that are occurring within every part of each cell, we now understand the root cause of these diseases you and I would love to avoid, and is due to what is referred to as oxidative stress, or this dark side of oxygen. You see, it is all about balance. You want to have enough antioxidants and their supporting nutrients on board to handle the number of free radicals you're producing. Then there is no oxidative stress, and you give yourself the absolute best chance of protecting and maintaining your health. You see, my patients aren't as concerned anymore as to the number of years in their life as they are the quality of life in those years. It is certainly much easier to maintain your health than trying to regain your health after you've lost it. So what am I actually telling my patients who desire to become more proactive in maintaining their health? I share with them that they definitely need to be eating a healthy diet that contains those good low glycemic carbohydrates, good fats, and good proteins, and they need to establish a modest, consistent exercise program. However, now I'm also recommending that they consume high-quality nutritional supplements that provide all of these essential nutrients at their optimal or advanced levels, or those levels that have been shown to provide a health benefit in our medical literature. So how do you choose a high-quality nutritional supplement? Well, first of all, you are not going to get what I recommend in a one-a-day multiple vitamin. One-a-day vitamins are based on RDA levels of nutrients, which have been shown over and over in our medical literature to not provide any health benefits. However, the major problem in being able to choose a high-quality supplement is the fact that the FDA basically looks at nutritional supplements as foods. Several studies have documented the fact that most nutritional supplements do not have the amount of nutrient listed on the label actually in their tablets or capsules. They also show that many of the nutritional supplements sold today do not even dissolve. So it doesn't matter what is even in the tablet or capsule if they don't dissolve. Other studies show that the overwhelming majority of supplements in the marketplace today use inferior products that are difficult to absorb and are poorly utilized by the body. They also show that many of the products actually contain toxins and heavy metals that can be damaging to the body. Now, the FDA is certainly trying to raise the bar when it comes to manufacturing practices and the quality of nutritional supplements. However, the majority of manufacturers of nutritional supplements simply follow what is known as food-grade good manufacturing practices. In order to achieve this level of quality, they primarily just need to clean their plates and wash their hands. The next level of quality is referred to as dietary supplement good manufacturing practices. Now, this is definitely an improvement. However, it still lacks the level of quality I want for my patients. Therefore, I only recommend that my patients consume nutritional products that have been produced and manufactured in a drug-certified facility. In other words, they have been approved and inspected by the FDA and are actually licensed to manufacture over-the-counter drugs. This means that they are OTC certified. The only higher level or standard of manufacturing is held by pharmaceutical companies, which are licensed to manufacture prescription medication. I also want to be sure that the nutritional supplements my patients consume actually dissolve. This means that the manufacturer must be U.S. Pharmacopeia or USP compliant, so that I am confident that the quality and dissolution of the capsules or tablets meets their standards. It is also important that a company that manufactures nutritional products be NSF certified. This is an independent third-party organization that inspects the manufacturing facility and assures us that the manufacturing practice claims a particular company is making are actually true. The nutritional supplements I recommend to my patients must also contain all of the essential nutrients at their optimal or advanced levels. However, it is just as important that that company I recommend be forthright in sharing with me and my patients exactly where they get their raw products. Most companies are not willing to share this information with their customers because they feel this is a trade secret. However, this also gives them the latitude and opportunity to change or lower the quality of their raw products anytime they choose. The company I used to recommend to my patients certainly was not willing to share where they obtained their raw products, and this always concerned me. However, for the past 18 months, I have been recommending nutritional products that have been developed and manufactured by RX. Their products are manufactured in an FDA-registered facility that is also certified to manufacture over-the-counter drugs. In other words, their manufacturing facility is a drug-certified facility. This places them in a league of their own. They are also USP compliant and are NSF certified. RX's Optimals not only meet my criteria for quality and completeness, but they actually exceed them. They contain several additional potent and expensive nutrients that are not in most other companies' products. These are nutrients like grapeseed extract, resveratrol, alpha-lipoic acid, olive leaf extract, along with a super plant blend and fruit blend that provides those whole food extracts. They share openly with anyone who asks where they get their raw products. For example, they get their grapeseed extract from Andina Corporation out of Italy. Now, this is a family-owned company which has grown a unique Chardonnay grape that produces the most potent grapeseed extract in the world today. Even though it's twice as expensive as the next best grapeseed, RX is only concerned in having the highest quality raw products in their supplements. They get their fish oil from a company in Canada that only uses fish oil that comes from smaller, less polluted fish like anchovies or sardines. They use a natural purification process that makes their fish oil the purest in the marketplace today. RX uses the most potent and highest quality CoQ10, which comes from Konica Corporation called ubiquinol. I am personally not aware of any other network marketing company that uses this highly absorbable and this highest quality form of CoQ10. Now, I have been involved in nutritional medicine for over 18 years. I certainly saw good health results in my patients with nutritional products I used to recommend. However, I am now even seeing better health results in my patients since I've been recommending the RX Nutritionals. My patients are noting significant improvement in their health, and it's happening much faster than I have ever witnessed before. RX is literally taking nutritional medicine to the next level. I would challenge anyone to give RX supplements a 5 to 6 month trial to experience this difference themselves, even if they feel they are now consuming a high-quality supplement. I personally feel that the RX products can especially make a major difference in the health of the Chinese people, the US people, and people around the world.